Thanks for joining us. This is Live with Miami's Community News, and I'm honored to have two professionals that are going to help us walk through the mental health crisis that's going on and the services that are available. To my media writer, Susan Racher, with the National Alliance of Mental Illness. I finally got it right? And tell us, if you would, what you do, what the association, what the organization does for people. And we're going to be on to the doctor in 1 second.
Sure. NAMI, Miami-Dade, is the Miami-Dade and Monroe County affiliate for the National Alliance on Mental Illness. And we're the largest peer-led support organization, support education and advocacy. So we don't substitute for good clinical, medical, and pharmacological and psychological help. What we do is we support individuals who are living with mental health challenges in their recovery, and we help their families as well. And family supports, family broadly defined, family supports are really important in helping folks with mental health crises recover.
Perfect. And Dr. John Newcomer is the CEO of Thriving Mind South Florida. Tell us about yourself, if you would, and what the organization does, and why, out of all the things that you could do, you've chosen this field.
Yeah, thanks, Michael. So I'm a psychiatrist by training. And for the last 3 years, the CEO president of this organization, Thriving Mind is one of 7 so-called managing entities here in Florida that essentially are the safety net funders for mental health and substance use services. So for those people who don't have commercial insurance, they didn't qualify for Medicaid, they're not a veteran, who's paying for their services, there is a safety net. Every state has one, different sizes, but essentially we fund about 40 some odd healthcare provider organizations, Citrus, Banyan, Jackson, et cetera, to have an array of services, inpatient to outpatient, on up to prevention.
So somebody who is in crisis or about to be in crisis, they're worried about the money, they could certainly call you and say, I need some help. Not too long ago, I got a text, Michael, I need your help. I was floored. I was like, wow, I've known this person for years. I said, this must be really something for a grown man to be able to do that. And I was honored to be able to help him, and for the people that also helped us along. So I understand there's a facility, intake building, right, for what is called the Mental Center. Mental, is that yours?
So there is a building that we're renovating downtown.
Yes, that's one.
It's called the Miami Center for Mental Health and
There
Recovery.
You go. Couldn't read the writing.
And basically, this is an additional facility that would add to the whole system. It's about 180,000 square feet. And we're renovating it using Miami-Dade County general obligation bond funds and some public health trust funds. Probably will be completed in the late spring of 2022. And at that point, the county will, have some plans in place for opening and building some capacity.
When I was in therapy many years ago, I enjoyed it. I actually had to read a book, which was how and when to say goodbye to your therapist. And it was difficult, right? But I used to be a registered nurse, but I was in that arena, so I was a little more comfortable with it. But there still is this social stigma that's attached to it. I'm thankful for the athletes that have come out and said, hey, I'm just a person, all right, who happens to be good at that. So what's being done, for all of us, so that people are more apt to say, you say I have a broken hand, but when you say I've got an injured heart or my mind's not working quite the way I want it, what's out there so they won't have to deal so much with the social stigma part?
Well, the best thing that's out there is Michael Miller and Community News. You've really lifted up this conversation. This is a 4th or 5th time that we've been together, and I appreciate that. So many organizations are aiming to reduce stigma. NAMI has a program in the high schools called Ending the Silence, where we present for an hour during the school period so that young people in middle and high school understand that mental illnesses are normal. They're to be expected in some ways, and that they should not be afraid. If they're not feeling well, they should ask for help. The secret sauce to this program is a presentation by a young person in recovery from a mental illness, whether it's depression, bipolar, and so forth. The organizations at Thriving Mind supports had focus on prevention, and Jackson this week had a
Yeah.
big mental health fair. And so a lot is being done, not enough, but a lot more is being done now.
So we know, Doc, in when you're growing up or even afterwards, you're part of this big family, all right? And so many people feel isolated, all right, that they feel as though that they're actually alone when in fact they're not, because the tentacles of our families, the immediate ones that are out there, are all together. And so many people have a problem going to where they're having to their family members and say, hey, I got a problem, all right? So, Doc, what's for a young person that's struggling, all right,
Yeah.
and they're anxious and then they're depressed, and the last 2 years, all that's going on everywhere. What would you suggest for them when they're feeling a little nervous and they're feeling a little disconnected?
Well, I think there's maybe two questions embedded in there.
Mhm.
One is, if you're in distress and you need to talk to someone, one of the providers in our community that we fund is 211, Jewish Community Services. So you can call 211 24/7 and talk to someone who can help direct you to any services that you might need, for example. But I think, Michael, the other question in there is, what about just learning more? You're trying to find out, is the depression or the anxiety that I'm feeling, is this normal, or is this something I need to treat? And gosh, if I had to recommend one site above everything else, it's the National Institutes of Health. They have a National Institute of Mental Health, which has great informational pages for everybody, for consumers. It's not just, scientists or doctors. So great information on there. And I think it's to a point you were making just a minute ago.
Mhm.
Everybody's going to experience something along the spectrum, and we have one word, right? Depression. And that word covers, oddly, the entire spectrum. So I dare you to find anybody on the planet, right? They won't be telling you the truth if they say they've never felt sadness or they've never been depressed. But only a small portion of those folks went on to develop a very serious depression that involved all these different changes in biology, sleep, appetite, appetitive functions. And those folks needed treatment.
So I have psoriatic arthritis, and I don't have a skin. And I'm watching the commercial last time. Maybe I was reading fatigue and went right down the list. I went, oh, there it is. And you talk about education. And so now when there's a flare up, I'm more acutely aware of it. So I'm not as sad that I can't move around as much, or that something's going on. Sometimes I'll be going like this. And now it's starting to make sense, because it just took a minute and plus 50 plus years to look at it and say, maybe there's some real stuff that's going on.
Yeah.
We know
Right.
there's lots of food insecurity and parent insecurity, and look at all the children that were left without any healthcare providers, without any parents or sisters, brothers. 700,000 people died. They were all somebody to somebody else for the most part.
Mm-hmm.
So why don't you tell us about how when people are feeling that, all right, what's the point in which they call you? Where are they typically at the beginning, middle, or, hey, I'm ready to get Baker active because I'm afraid I'm going to hurt somebody?
For NAMI, it's
Yes.
all of the above. And sometimes it's not about them. It's about somebody they care very deeply about. We have had calls from individuals who we've had to keep them on the line while we sent 911 out, because they were threatening to end their lives and harm themselves. And we've had folks who are just slightly depressed and don't know where to turn for help. Getting the message out that it's okay to talk about it is really important. But John mentioned 211, and 211 is an important resource, and it's being amped up on steroids by federal legislation that was signed in the National Suicide Prevention Act of 2020. And there will be in July of 2022 a 988 number. It will be one number for all mental health needs. And it will be met by trained folks who can manage those mental health needs. Florida and other states are working on gearing up right now, and it's a big project.
So that happens because of people like yourselves to pushing this, to make it
Yes.
okay, to be able to have that conversation. Before can we key up a YouTube video? This is a young man, All right. His name is Matt. All right. And you can tell him who you want after he plays. And then, and what drove him to sing like this? All right. And if you, so we'll watch it. And it's 2 minutes. Is this 2 minutes? Do you know?
It's a little. I think it's 4.
Okay.
But
We'll watch it for a couple
we can
minutes.
fast forward it.
Okay. All right, folks. All right. And we talked with Matt about 6 months or so ago.
Exactly.
A little bit louder, please. Andrea, can turn up a little bit.
So
that's it.
many days we spent in pure bliss, graced by this love we did witness. Laugh like children, let our love roam, dangled our hopes on dreams of a home. But now our souls are hardened and our tongues are tied and our eyes are heavy, like the tears that we've cried. So baby, please remember, you are not alone. I am here, and Lord knows I will try. Baby, I will try. So baby, please remember, you're not alone. I am here, I am here. Baby, I will try.
Thank you, Andres. Music is tremendous. It puts you in that place as I'm listening and I'm watching and you see the people that are involved. It's really tremendous. Would you like to say who that is?
That's my son, Matt.
Okay.
I'm so proud of him. But what gave rise to that song is that message of not being alone is really important in this community. And that's one of the reasons why John and I are here. The resources and the system that John manages is well run, and it's really important for people who need help. And then there are ancillary support services like NAMI that are out there as well. That ends up, the very end of that video, the young girl who is really in distress types on her phone, help me. And the text comes back, I'm on my way. And that's what we want with 988 and 211. Not only somebody to talk to, but I'm on my way. You know, you don't have to be in distress alone.
And thanks for that, because there are a lot of people that what they want to be is they want to be connected to people. And certainly during the last 2 years, there's been this massive disconnection, right? And I think I told you this a year and a quarter ago, I had a pedicure here. Instead of going to a place, I go home, my wife wouldn't let me in the house. She was so afraid that I was going to give her COVID. So I added a little twist to it. I said, you know what? So we did a video here. Here's my kitchen, here's my bathroom, here's my shower, and here's my cot. All right. And she says, you know what you could do with all that stuff? But it took a while for me to get connected to that, to understand somebody else's feelings about what was happening. Even though that outwardly we all experienced something that's similar, but internally people handle a lot differently. We only had one case of COVID here, right? In the year and a half. That was about 2 months ago. But when it was time for the booster shots a month ago, and I said, who wants their booster shot? Every person. So I'm sort of a private guy, so I arranged the appointments. They were all within 15 minutes of each other. They all wound up at the same place together. So there's that relief that's going on. And looking forward to a time, and we hope not too distant future, when the COVID's going to be more under control. What should we expect as human beings as we recover emotionally from? What are some of the things, Doc, that we might be going through?
Yeah, so I mean, I think we're going to be dealing with this in one form or another for a while longer. And we did see an uptick in calls, 211 calls, for example, and other indicators of distress. It's interesting, Michael. I mean, in some cases, particularly remember at the beginning of the pandemic, times when people were afraid to go out, we had, it was really critical. People who were already in treatment, they were just like somebody who's taking good care of their diabetes. They were taking really good care of their mental health and their mental illness, but they didn't want to get on a bus and go to see their doctor. So we have so-called in-home on-site services. We'd send people out, to take their medicine, their medication refill to them, and have their case manager visit them in their home or wherever they wanted to meet. But, I think you've got to have a highly adaptive system to be able to meet people where they are. It's hard to say, how each individual is going to respond. It's funny. A lot of folks who don't have or didn't have and still don't have a serious mental illness are now talking more about mental health, which is a really great thing.
Yes.
And they're recognizing early warning signs or early symptoms of anxiety and depression. It's a great discussion. But those individuals don't have a serious mental illness. Most of the folks that we take care of, we help about 50,000 people a year here in Miami-Dade and Monroe. If you count prevention, it's about 135,000 all in. And most of the folks receiving treatment services have a serious mental illness, and they're living below 200% of the federal poverty level, and they're uninsured, as I mentioned earlier. For them, you've got to have a whole array of services. Not everybody needs crisis services. Susan and I talk about this a lot. If you can intervene early, catch someone when they're first having their first, serious episode. In some cases, you bend the curve tremendously. They don't end up in the hospital, and you manage the illness for a long time.
And you're so right. We were having a conversation with top executive with a hospital chain, and what he said is, Michael, we want to take care of the people way before they need to be hospitalized, because when they go to ER, it's a big problem, big challenge, lots of time, energy, and money. And we know, I don't know how many homeless people there are. About more or less what percentage of people that are homeless for long periods of time have significant mental impairment.
Yeah, so the homeless population is not homogeneous, right? So there's roughly 6,000 people categorized as homeless in Miami-Dade and Monroe, but only about 1,000 who end up, little less than 1,000 now, ending up on the street each night, unable to be connected with a shelter or housing solution. It's that population, Michael, that for a variety of reasons aren't able to connect. That's where you see a pretty enriched population of folks with mental health and substance use problems.
That's all the work that Matthew's doing right now. He is a community outreach person for the University of Miami, Idea Needle Exchange, which delivers medicine and medical treatment to the homeless. They visit the home. They have addresses. So Joe is under the bridge on 995 and 7th, Avenue, and Jane is over here. And it's
those kind of outreach programs can get that connection. We hope. My brother Grant went at Christmas time. I don't know if whatever Christmas it was the last couple of years, he went under the bridges downtown with a camera. He came back. He was shell shocked. When we kept writing about the homeless issue, that we need to pick this up to get this to another level. And I wanted to share with you about 4 years ago, somebody comes over and says to me, Michael, I want to kill myself. Okay. I said, can you hold on 1 second? I went and got somebody else. I said, would you tell her what you just told me? That I want to kill myself. Okay. You have your phone here? All right. Yes. I said, I want you to dial a family member. So the family member got on the phone, all right? They had the conversation. They came and they picked up this person and took them. When the best that I could do was get them to that family member, all right?
Yeah.
But if somebody says to somebody else, hey, I'm really depressed and I want to hurt myself or somebody else, what should that person, or what could they do? Susan or Doc?
Well, why don't I start? That there is a system, here in Miami-Dade County, multiple crisis stabilization units, a central receiving facility. But as Susan and I were saying earlier, 211, is one-stop shopping to initiate that process if you don't know where to go and you're not sure what the next step is. As Susan mentioned, when there's a risk of imminent danger for someone, as you mentioned in your example, Michael, they might be a danger to themselves or to others, then at that point, you don't mess around, you call 911. And I should just mention that here in Miami-Dade, we have officers who've undergone extensive training in they're called so-called CIT officers, and it's a crisis intervention training that they've undergone, so that when that officer walks up on the situation, they're not starting from scratch in understanding what some of the mental health issues might be.
But if I can, I'd like to share a vision, because the system, there's potential for much more. If you have that issue, self-harm, so you're not going to hurt somebody else, but somebody is suicidal, calling 911 will bring the police in uniform with sirens going, one car, maybe more, maybe two. If that person needs to go to the hospital, the police will escort them in the back of the car for police protection, handcuffed. If you make that call in Georgia or in Tucson or in San Francisco or in parts of Oregon, parts of Utah, you will be triaged by a call center that will interview that person, try to deal with it on the phone. If not, send out a mobile response team to the house of social workers who can transport that person, who can make outpatient appointments, and who can follow up to see if that person is getting the services. And that's the kind of vision that we're working on, that we want to implement as 988 is being implemented. It's a very important change in the system.
And I get it. When the cops come, they got guns and they're all keyed up, all right? The person's scared, maybe hallucinating a little, all right? And along that line, to support your position of, do you really want the police to be there? About 15 years ago, I was training to run a big race, and I'd hurt my leg. And then some young man comes over and says, your brother owes me some money. I said, you need to deal with him on that. I'm trying to eat and wonder what I'm going to do about entering the New York Marathon 4 days later. And I'm like completely freaked out. He starts yelling at me. So I said, I'm going to call the police. And I'm thinking, oh no, I'm going to call the police. They're going to come over. It's going to wind up at the Miami Herald. The girls that are sitting, so I picked him up and I put him outside. I was right next to the door. Well, he swung at me. And so I wasn't fast enough to move out of the way, so I hit him. So he falls, pulls off my suspenders, my pants fall down, and at that moment, a lady drives up and parks right next to him. And I said, ma'am, you need to move your car. And at that point, our security guard was coming out. She said, why? I said, because you just need to move it. Well, it turns out, all right, I could have killed him when him falling, all right, easily, all right. And then it turns out that I broke 2 fingers. So what I realized is I handled it the wrong way, all right, because it got out of control for me. So I'm very hesitant now in dealing with people that are having a sort of a crisis. Now, we know there's so many people that are under stress because of everything that is going on. And the kids are suffering, all right? And we see that I have 2 grandkids. One is 5 years old. So for 2 years, almost, she's been, a third of her life. She's been walking around, mask, no mask, whatever. So, Doc, what is it a parent can do to help their young children or their elderly parents get back into a routine that's acceptable?
Well, I think, all these kinds of conversations and talking about the issues and having whatever contact you're able to have. I think lots of examples are out there. Again, the National Institute of Mental Health and the CDC have nice sort of educational videos for parents in helping their children. We have a connection with Sesame Street and Communities at Thriving Mind, and they have wonderful tools to help parents communicate with kids about very difficult issues. But I think you can't solve those problems without having a conversation. And the amazing thing that is probably one of the take-home messages that I would say to the audience is just say what you're thinking. Talk. Go ahead and bring it up. And don't. People aren't made of glass. You can ask them how they're feeling. You can say, I'm worried about you being alone. Tell me how you're feeling. Is this getting to you? And you know what? People will answer you. You ask them a question, they answer. It's amazing.
Are you going to hurt yourself?
Are you going to hurt yourself?
I have a 6-year-old grandchild and a 3.5-year-old. Also, take it for parents of young children. Get out in nature. I mean, there's this whole movement now called forest bathing. It does amazing things for kids' mental health. They don't need to be in front of the screen.
I walk around in my backyard, sometimes just with flip-flops and shorts, just to
get it in.
Occasionally, I do some midnight bathing, if you will. Right. A couple of years ago, when I was running with a friend, and I was not feeling well, and he said to me, "How you doing?" And for the first time ever, and I remember them for 15 years, I said, "I'm not doing good." And he looked at me and said, "Why don't we sit down?" So we sat down. I see the fire truck, the fire, rescue. I said, "Okay, I'm feeling a little better." Well, half an hour later, I was fine and I finished. So when he got COVID 6 months ago, I called him up and I reminded him what he did for me. And just being there and listening, to me. All right. And so there we were on the phone for a long time. He said, "Michael, this is a disease of loneliness.
Yeah.
Hospital, or you're at home, and who are you going to give it to?" When he got better, the connection that we had, I've known him for 20 years, was stronger than ever before. It just was amazing. It opened all these doors about, looking inside and being there for one another.
In some ways, just by asking the one question.
Yes, as you said.
Yeah.
But I do want to circle back to something that Susan said. So there are these cities right now that are doing really cutting edge things. We're working now with the National Council for Wellness and the American Psychiatric Association's foundation to be one of 6 cities in the country to be looking at these sort of innovative approaches. Our challenge in Miami right now is we have some of the building blocks. We have mobile response units. Okay, there aren't enough of them, and they're not connected in the way that Susan was saying is sort of the cutting edge model. They're not connected so that every call to 911 gets a chance at that mobile response triage. If that could work.
We have 7 911 call centers. So if I call 911 in Pinecrest, I get Pinecrest. If you call 911 in the city of Miami, you get city of Miami. If you're in the county, you get county, and they're not connected.
When we saw what Miami-Dade County did to mobilize units to go out and give people COVID shots, right, for the people that were really not connected like the rest of us, right, or like a lot of us, right, it was amazing to see the difference that it made, all right? And in deep South Dade, or wherever it happened to be, my hat's off to CHI and the county that really made that happen. Colonel Hadley.
They're one of our providers that we fund. Yeah,
I give so much credit to that organization.
Amazing.
And I know he's over age of 70, but I still think he's got a couple of years, but he's on to some other stuff. And so when we look to Miami-Dade County, we know that we have the desire to do that, all right? And it's like, how does it happen, all right?
Yeah.
And when we saw how, if you're 70 or older, you do this, you're 60 or older, you're 50 or older, and there was a real method to the madness, if you will, and it worked out. I'm proud that, we're here and that we were able to do so much for that.
It's organizations coming together and it's collaboration, and we're working on it. But it's it's going to be a big project. The county is very much involved in this, and like it or not, July 2022 there will be a 988. It's a federal
coming up.
Yeah, it's coming up.
When I was in college, or after that, I'd look at on the insurance policy. What psychiatric care? What's your reimbursement? It was always terrible.
Yeah.
All right. Always have a friend who's running a hospital for 25 years. He said, "Mike, we used to get 90 days, sex, drugs, rock and roll." I spoke to him a couple of years ago, maybe 30 days, maybe. All right.
Michael, you're bringing up another topic which is worth commenting on for this program, and that is there's also federal legislation, right, from many years ago that says that there's supposed to be insurance parity. There isn't supposed to be a different standard for the benefits you would get in your insurance for diabetes care or heart disease care versus mental health care. But I think we all know that in practice, there still is that different standard.
So when my daughter, she's 35, was this big, she said, "Daddy, do you know if you hit me, if you hit me, I'm gonna call the police." I said, "That's great. Where did you live?" "School." All right. And it's like, wow. All right. So we realized that the school system teaches these people, the kids, about it's okay if this is what's going on, right?
Yeah.
And it's okay to talk about that. But even in the work environment, I hear people saying, "Oh, I broke my finger. Oh, I was out chopping some wood." And I don't hear too much, "Hey, I feel my heart is broken."
Yeah.
But I think that it seems to be, the more awareness there is, the more
It lowers
comfortable
the
people
barriers.
are.
Yeah, it allows people more comfort in talking about these things. And I think it's also a generational thing.
Yeah.
So I notice in our organization, right, we fund these other organizations, but we have our own. And the younger people feel more comfortable talking about this stuff and going to HR and saying, okay, I want to go through our insurance. Who should I talk to for this kind of thing? Which is a plus, right? And think about the transformation that took place and how people thought about and talked about cancer.
Yes.
When they talk about the costs of mental health, mental illnesses, and that it's the number one disability cost in the world to employers, they're also talking about losing really good, talented, and well-trained people to mental health crises. And when an employer has a flexible mental health policy, which more of them are having now,
Yeah.
I'm hearing more people say, "I'm taking a mental health day off." You retain employees.
And that's really good to be able
win-win.
to bring it up and be able to talk about it. Years ago, we, as part of the half-cent sales tax, we were delighted that we had a social worker come down 9 sessions a year,
Mhm.
right? So we were lining up from October to March, so we get 2 years. First day he binds up, like it was, hi. After 2 hours, the jacket would be off.
Yeah.
After 3 hours, like this. But people felt so good because we were very welcoming like that.
Mhm.
And so they would use my office finally about, he was like falling over because people were talking to him. But one of the things that really happened is that people became more open here with us. We had more people that came to me and said, "We want to do more." Other people said, "I've been trying to quit. I just didn't have the guts to tell you." I said, "Well, congratulations." Right?
Yeah.
Yeah.
But as an employer, I mean, it's just good business
Yes.
sense.
Business.
It's about, after you go to all the trouble to hire a great person, it's about, retention and fulfilling your investment. I want to make another point, and that's about the effectiveness of treatment. So people tend to think that mental health issues, treatment is sort of wishy-washy and talk therapy, who knows if it works. That's how people act. But in fact, if you look at all the evidence-based therapies for the treatment of depression or psychosis or bipolar or anxiety, on and on, the effectiveness rate, the percent of people who will respond, correctly to treatment looks like the response rates to cardiac disease, hypertension, diabetes, totally on par or better in some cases.
So there's nothing better than having a really open, maybe a cryful session with your spouse or children to be reinvigorated. It's just like a new day, all right?
Yeah.
Because this stuff is back there, and we've certainly seen that. And with a lot of guests that we've had here, and we see it, that they're under a lot of stress. And now it seems to be getting better. But if somebody's concerned that life seems better, but they're still suffering the consequences of the bombing of COVID, but they didn't die. But lots of their friends, but people they know, I know there are going to be some consequences. For me personally, I look at that my perception about life has changed.
Mhm.
700,000 people died plus,
Mhm.
and we sort of we almost desensitized. Oh, only 1,000 people died this week. Only this, only that. Oh my goodness! It boggles the brain that how we handle that. So
Yeah.
I'm waiting for the next step, whatever that is. Okay, you're here, you survived it, if you will, and the next step of getting a little bit healthier, right?
Right.
So if we were to look down the road and let's say next June, right, which is not that far away, what does it look like for us in the mental health and COVID experience?
Well, I mean, I think we're still going to be dealing with COVID in some capacity. As you mentioned, Michael, people, of course, are continuing now to come to terms with so many losses. Everybody knows somebody that was either seriously ill or lost to COVID. Having said that, I do want to make a plug whenever we're talking about mental illness and disease. I also want to talk about resilience. Humans are amazing. Kids, adults, older people, you can expose them to tremendous stresses. I mean, like a pandemic. And most people, I'm not saying most people don't get sad. I mean, they appropriately get sad. They appropriately are distressed. But most people don't develop a major depression, for example. And it really speaks to, and again, the NIH has spent a lot of time trying to understand not just illness, but resilience. And why is it that some people are doing better than others? But I think it's the important take home is that it's good to talk about this stuff. It's good to air the feelings. You said it earlier, knowledge is good. Knowledge is very powerful and liberating. If you learn more about what you're going through, then you understand what to look for if it's getting bad. But the fact is, you may really be able to incorporate this into your life. It's not going to be a happy time that you'll look back on, but it's a time that you survived.
I already feel better with the doc here. It's perfect.
Great.
So, Susan,
I think-
tell us why you're involved. You're the volunteer president
Yeah.
of the National Alliance for Mental Illness. Why are you doing this?
The support and education that I received from NAMI in Broward County, because we had restarted Miami in 2015, 2016, long after I needed it. I needed the support of NAMI. The support that I received was instrumental in helping Matt recover. And you met Matt through
Yes.
the video and previously. A person cannot recover. He had a serious mental illness, not like the situational issues that we're talking about now. And the fact that he had an educated family who knew how to speak to him, how to work with him, how to work with his mental health care providers, and how to self-care for themselves while they were going through this family crisis helped, in my view, expedite, accelerate, and solidify his recovery. And so now that he's on his own and he's in great shape and working and getting a master's degree in social work and doing community outreach with the homeless, it was really important for me to help build NAMI in Miami so that people would have that support. Because as I mentioned, medical and clinical care is really important. But so is having a group that you could drop in on without registration. Everything is free, to talk about how you're feeling in a safe environment without judgment. The other thing in response to your other question about where are we in June, one of the good things I'm seeing is that there's an increased emphasis on self-care, and that's exercise, nutrition, and taking things like mindfulness. So NAMI is offering mindfulness classes, and we were oversubscribed. People who want to learn how to calm themselves down, how to self-regulate their feelings and their thoughts and all that. And I think that's really important in contributing to resilience.
And Doc, you literally affect, both you do, thousands and thousands of people a year. It was one point earlier in your career, were you a private practitioner?
I've always had a small, private practice, and for many years was doing research. Mostly diabetes and cognitive sorts of research. But I gotta say that at this point, and it's not just me saying this is the director of the National Institute of Mental Health, for example, for the last, decade or so. our knowledge about how, with mindfulness training, for example, our knowledge about how to build resilience
Mhm.
and treat illness is so much more advanced than we have effectively implemented. So we've got stuff sitting on the shelf that we're not
Good
doing.
point.
And that's what made me do what I'm doing right now, is this opportunity to try to translate these innovations into practice and really get what we know out onto the playing field.
And I thank you for doing that. That
Mhm.
the COVID has made us do so many different things, being innovative, right? Figure out how to maneuver through this disease, how to have relationships with people that weren't like they were before, right? It's a little different, right? How to have a communication and go, I've never seen their face. It's always been like this. And it's like, I wonder what they look like, right? And we never had dogs in the building before. People come with their dogs now.
Yeah.
And it's like, okay, great, all right?
Yeah.
Just don't drool on me. And it's fine. And so we see that there are a lot more caring people that, if you will, are being open about it, whether it's in mental health care or in gymnasiums and personal trainers. And we see that people are certainly more acutely aware of themselves and their environment, all right?
Mhm.
And you go, oh, how about that? And we know that we live in lots of places, yesterday, today, and tomorrow. So we look at the people at the football games and you go, I don't know, hear 50,000 of them didn't get it, and other people are frightened, and other people said, I'm ready to move forward. So everybody's in a different place.
Right.
And,
Right.
And thank you for what you do and for keeping us all in a better mental health position. And I certainly feel better today, folks.
Good.
Listen up.
No, thank you for this
Thank
show and for focusing,
For
as
lifting
you have
up the
for several
conversation.
sessions on this topic.
Can we direct folks to a couple websites?
Yeah, go ahead.
Okay. So if for information about Thriving Mind, thrivingmind.org has an amazing website where there's a phone number that you can call. For NAMI Miami-Dade, we have 9 support groups a week. They're currently on Zoom. It's namimiami.org. And I also want to encourage, for those of you who want to see a better mental health community, access to the innovations that John referred to, that we want to bring into Florida, that we should have, that are being done elsewhere. Sign on to Florida Mental Health Advocacy Coalition.org, FLMHAC.org. It's a coalition of 27 county-based affiliates, NAMIs and NAMI Florida and Mental Health America, that are working together to systematize improvements to mental health through legislative advocacy, statewide and locally. FLMHAC.org.
And just Google National Institute of Mental Health.
Yeah.
And you'll get a ton of information.
One thing I would like to do today is to get ready to wrap up. I'm sure that from the time you're a young person until now, there's been a mentor, people that you admired, people that taught you. Would you like to share with what you learned and perhaps their name, if you'd like to do that?
I think my biggest mentor was my mother. She had a quest for excellence in terms of everything that we had to do. And I think from an early age, she really instilled in me a love of learning. I'm not the person who had the 180 IQ or anything like that. But one thing I love to do is scale that learning curve and learn about new things, like mental health a decade ago when Matthew got sick. And so it's my mom.
You're killing me, because if I don't say my mother,
she's gonna.
I'm gonna be in big trouble, right? So
John's mother was a great mentor to me. No,
no. So in addition to my mother, there have just been some wonderful mentors who, probably the most important bit of advice was, and we're working on a strategic plan right now, so it's topical. It's to be looking over the horizon. In other words, you can't have a 1-year plan or a 3-year plan or a 5-year plan. He would always say 7 years. And we'd be saying, how can you possibly plan for 7 years? He said, that's the point.
Mm-hmm.
I wrote a story about driving up to a stoplight and seeing the homeless person coming over to me. And so I'm writing what I'm thinking. I don't want him to come near me. No. But you want to give him some money. So you're going to give him coins, but not touch his hand. Reach in your pocket, Michael. Take whatever bill it is, a 1, a 5, a 10, a 20, sometimes a 50. What are you going to do? And I had this whole 400-word
Conversation.
conversation. And then I said, oops, the light turns green. I'm on to my next lesson. So we are. Thank you very much for
Thank
being here.
you.
And thanks
Thank
for what you do
you.
for all of us. Again, folks, if you need some help, you can dial 211. You can call the Thriving Mind of South Florida. You call
NAMI Miami
NAMI
Dade.
Miami. Go online. You can find lots of help. And it's going to get better. Thanks again for joining us. And have a great day.
Thank you.